Welcome to familydoctor.expert. I'm Grant Blashki, I'm a GP. I'm sitting here with my cup of tea with low fat milk, of course, here to talk to you about high cholesterol. Very often you'll get called back to your doctor and go, listen, your cholesterol's a little bit high, we've got to do something about this. Why do we care? Why do we care about high cholesterol? Well, it's associated with clogging of the arteries, what we call atherosclerosis, which is associated with heart disease and strokes and even clogging of some of the vessels to your legs and things when you get older. So we want to head off trouble and treat high cholesterol fairly actively. Cholesterol's not all bad. Actually, cholesterol is very important for making the cells in your body and also for making hormones and lots of other things in your body. So you need some cholesterol, and most of your cholesterol gets made by your liver. So 70% in fact is made by your liver. So a lot of people with high cholesterol, actually it's not what they're eating, it's just the genetic lottery. In fact, some families have a thing called familial hypercholesterolemia, where they have super high cholesterols. And the unfortunate story in a lot of those families is that they have a strong history of people having heart attacks when they're pretty young and things like that. So, need to know that cholesterol is a bit more complicated than just one variety. There's what we call the good guys, the HDLs, the high density lipoproteins, and the bad guys, the LDLs. Usually when we just say cholesterol, we're talking about the LDLs. And your doctor will be interested in the ratio of the bad guys to the good guys, the ratio of the LDLs to the HDLs, and we like that to be less than 4, ideally. Now, if your cholesterol is under 5.5 and you don't have any heart risk factors, we're pretty happy. Not much to do, maybe check it every couple of years, keep eating well, look after yourself. If you've got a history of heart risk factors, so you've had a heart attack in the past, or high blood pressure, or you smoke, diabetes, there's a good case to really try and chase your cholesterol right down to under 2. So why do we want to do that? Because we know we can halve your rate of having a heart attack and reduce your chance of having a stroke by about 20%. So it's well worth us chasing, and we certainly take it pretty seriously. So what happens if you've got high cholesterol? What I tend to do with my patients, if it's really, really high, we go straight to talking about medications. But generally I say, look, let's try for a few months and see what we can do with diet. Let's see if we can get your cholesterol down. So there's a few things you can do with your diet, and a lot of these you'll know, they're pretty obvious, but anyway, let's just run through them. So you want to avoid lots of sweets and lollies, high fat meats, processed meats aren't much good for your cholesterol. We want to avoid the saturated fats, avoid snack foods, things with lots of cholesterol in them, things like kidney, pate, liver, things with palm oil in them. All these sorts of foods we want to try and stay away from. And what do we want to eat? Again, just the obvious things. Lots of fruit, lots of vegetables, lots of legumes, things like beans and lentils, whole grain cereals, whole grain breads. Trying to avoid the refined carbohydrates, so refined being, white bread, white rice, white pasta, anything where they've taken out a whole lot of the grain, which makes it really easy to digest, but gives you a big jump in sugar and it's not as good for you. In terms of meats, lean meats, lots of fresh, oily fish is also really healthy for you. Now, it's fine to have dairy. In fact, we need dairy to get some calcium, but go for the low-fat options or the no-fat options. Eggs are okay. Having up to 6 a week is no problem. Some of the margarines now, there's some good sort of ones based on sunflower seed or olive oil or canola, and some of them have got plant-based sterols in the margarine, and that is shown to reduce your cholesterol as well. Just a quick comment on food labelling. I went down to the supermarket and I was absolutely amazed at the lack of congruity between the claims on the fronts of food and what it actually says when you have a look at the little nutrition table. The Australian government's put out a really good website which helps you read these complex little tables on the back of food, and I recommend that you have a look at them. But just to give you the basics, you know, look how much fat is in the food. Look for less than 10 grams per 100 grams of fat. Look for saturated fat being less than 3 grams per 100 grams. Look at the carbohydrates. Watch out for foods that have got more than 15 grams of sugar per 100 grams. Does it have some fibre? Look for foods that have got more than 3 grams per serving. And also look at the ingredients. They have to list the ingredients from most common to least common, and if they've got salt, fat or sugar up in the top 3, then it's probably not a great food. So you've had a go for 3 months, you've tried to get your cholesterol down. Happily, for some of you, that's all you'll need to do and you get your cholesterol down. Some of you will think, I need to take a medication. And there are some medications called statins. Now, there's been a lot of controversy around the statins, and they work by impairing the formation of cholesterol in your liver, and they can reduce your cholesterol level quite substantially. Now, there's good evidence that if you've had a history of heart disease, you're at high risk of heart disease, that lowering your cholesterol can make a big difference to your chance of having further problems. Where there's a bit more controversy is with people who don't have a history of heart disease but they've got a high cholesterol, and the evidence isn't as strong there that you actually can improve mortality rates by getting people's cholesterol down. So there's still a bit of debate there. Now, what dosage you go on of the medication, your doctor will work out with you. Obviously, the higher the cholesterol, the stronger the dose the doctor will give you. There's a couple of different medications: atorvastatin, Lipitor, rosuvastatin, Crestor, pravastatin, Pravachol, simvastatin, Zocor, and there's a few others as well. Some important side effects to know about with these medications, but as usual, have a look at the product information, speak to your doctor, don't just rely on this video. But some good things that you should know about. About 15% of people on the statins get muscle aches, and I see that in some of my patients, and it can be quite annoying for people enough that they go, look, I'm not going to take that medication. Rarely, I've never seen it, but it is a possibility you can get severe inflammation and destruction of the muscles and kidney failure and all sorts of trouble. But you should be aware that, you know, all these medications are strong medications and they can have a risk. There's some risk with the statins of increasing diabetes. Some will interact with other medications, and particularly some of them interact with grapefruit. So the statin story is not fully written. My sense is that if you've got a high risk of heart disease, it's a bit of a no-brainer. I reckon it's good to go on them. If you don't have a high risk of heart disease and your cholesterol's a little bit up, then go hard with the diet. If you've got a very high cholesterol, you know, particularly if you've got a familial hypercholesterolemia in your family, I would be inclined to really go hard and try and push your cholesterol down too. So there's no rule about it. It's a free world. We're just trying to reduce your risks for the long term. It's hard to weed through all the information. There's huge vested interests in these areas. These are billion dollar industries. So anyway, that's something worth considering. So the HDL story is a little bit more complicated. We know that having high HDLs is a little bit protective, is associated with less cardiovascular disease. We know that low HDLs is associated with more cardiovascular disease, so they're doing something. What we're not so sure about is if we push the HDLs up, how much that's actually going to improve morbidity and mortality. But look, it seems like a good idea. There's a lot of products around there trying to increase your omega-3, which pushes up your HDLs. Probably the fish oil tablets, you would have to have an enormous amount of them to actually push your HDL up. But maybe worth trying, and certainly having things with high omega-3 in it. There's quite a lot of fortified foods, but oily fish are particularly good at doing that as well. So that's the general story about high cholesterol. As usual, I wish you well from familydoctor.expert.